Hey everyone, thank you for having me. I think my presentation is going to be a little bit different than the previous ones because we're, I think, a little bit earlier on in our process. So I think we have a lot to learn from our previous presenters, but I think this might be interesting because we can tell you like where we've come from, where we think we're going, and kind of the thought process we have along the way. So next slide. I represent the San Francisco Department of Public Health's Climate and Health Program. I sit in our Office of Public Health Emergency Preparedness and Response, and we're funded through a grant from the CDC, the BRACE grant. And I like to view us as a bridge where we bring a health equity perspective into citywide climate mitigation and climate adaptation processes. I represent the Department of Public Health on the citywide climate the Hazards and Climate Resilience Plan, our FEMA Hazard Mitigation Plan. I represent the Department of Public Health on a lot of our climate action plan work. And I represent, and really our focus is to make sure that programs are equitable, that they're focused and centered on health. Then I bring a climate perspective to Department of Public Health programs and services and act as a subject matter expert on climate to adapt our services to increased heat, wildfire smoke, flooding, and extreme storms. Next slide. So I'm going to talk about one of our big projects recently, which has been the Heat and Air Quality Resilience Project. And we're going to talk a little bit about the background, why this project exists, and then what has come out of it so far. And then we're going to end with a couple sample actions that we're doing at the intersection of the built environment and preparedness for climate hazards. Next slide. So this is focused largely on heat, but the origin of the Heat and Air Quality Resilience Project was heat. Um, in 2017, temperatures hit 106 in San Francisco, which was the highest temperature ever recorded in the city. It hit 100 the following day, which was only, I think, the second time that it hit 100 2 days in a row. And you can see the graph to the right, which shows how heat waves, the 911 call volume. So we had like a 48% increase in 911 call volume and a nearly 20% increase in hospitalizations. And there was an executive directive by our mayor really to start centralizing heat and wildfire smoke preparedness. Next slide. Um, San Francisco is vulnerable to extreme heat and wildfire smoke. Even though it doesn't get hot very often comparatively to other places in San Francisco, when it does get hot, we get walloped. A 2006 California-wide epidemiological survey found that emergency department visits increased most in the Central Coast region, including San Francisco. Um, our low general temperature also means that we don't qualify for a lot of like incentive programs around heat or wildfire smoke, but mostly heat. And our temperatures are going to increase. So historically, we've averaged about 3 extreme heat days a year, which is 85 degrees, but we're expecting those to increase to an average of 15 with a maximum on especially high years of 50 by the end of the century. And then in really extreme heat days, days over 95 degrees, were almost unheard of historically in San Francisco. And we're going to have about two with a max of 10 a year, and which are the types of days which surge our 911 calls and our hospitalizations. Next slide. So why is San Francisco vulnerable? So I've identified 5 reasons, but there's more, I'm sure. The first one is urban heat islands. San Francisco is a city that has disproportionate impacts based on where you live, and this is for heat and for air quality. We have most of our industrial uses concentrated in the south and eastern side of the city, as well as our freeways and highways, and then as well as because of its industrial uses, our impervious surfaces. So you can see this is a satellite map taken during that 2017 heat wave, and you can see temperatures were significantly hotter towards the east and towards the south of our city comparatively to the west and north. And this lines pretty well up with the historical legacy of redlining. The second reason is housing quality. We are our buildings were not prepared for heat or wildfire smoke. A lot of our buildings have very little air conditioning. We're the least air conditioned city in the United States. We have little ventilation that isn't, non-mechanical. Um, and you can see that our temperature often is hotter inside of buildings than outside of buildings, and heat waves last longer and they break after inside after they would outside. We have vulnerable populations. We have a lot high concentration of older adults, of young children, and those live in the same neighborhoods that are most vulnerable to heat and tend to live in poor housing quality for heat preparedness. Community vulnerability is that we're just not really accustomed to heat. We're starting from zero. We don't have a lot of adaptive resources. It's not well socialized. And then the last one is political vulnerability, where heat and wildfire smoke didn't exist in any one department. I really liked the slide. I think it was Damien that, uh, and it might have been Kyle, of the three Spider-Men pointing at each other. Because when it comes to heat and wildfire smoke, that's kind of what it's been like, and especially internal air quality, which is it lives between many different departments. Um, like the emergency response side often lives in heat or I mean, in DPH or the Department of Emergency Management, but we know there's infrastructure solutions elsewhere that live in other departments. Next slide. So the Heat and Air Quality Resilience Project is a cross-sectoral initiative to get public, private, community, and academic stakeholders together to identify, plan, and implement medium to long-term extreme heat and wildfire smoke resilience strategies. We know that as heat increases year to year, wildfire smoke events increase year to year. We need to also prepare not only for the events in 2025, but for the ones in 2027, in 2030. Our objectives are to centralize heat and air quality resilience planning, really to bring all those different stakeholders together, to align objectives, to share research, to engage stakeholders, and to facilitate the technical implementation and evaluation of strategies. Next slide. So this is an initiative that is run by four different agencies: Public Health, Office of Resiliency and Capital Planning, the Department of Emergency Management, and our San Francisco Environment Department. And it's co-led by myself and a colleague from our Office of Resilience and Capital Planning. And this was strategic to bring the human-centered emergency response approach from public health and emergency management with the infrastructure systems approach of ORCP and SFE. Next slide. So we leaned really heavy into planning. Um, we knew that because we're kind of starting from zero when it comes to heat and wildfire smoke preparedness, that we needed to get consensus of all different stakeholders. So we had four different work groups. One of the work groups was all community-based organizations, and the real goal was to identify what are the major barriers to resilience right now. And then we took those barriers and brought them to the other work groups that maybe had more city staff or practitioners, but we really wanted the core of the plan to be community. And we had four different chapters. And the first chapter is to make sure our buildings were adapted to reduce exposure to extreme heat and wildfire smoke events, highlighting that that is a real barrier to resilience. Next slide. So this is another tool that we've used to kind of make the case for why um, programs to focus on uh, adapting the built environment and homes are really important. And this comes from UCSF and the Prize Center. And I saw Nicholas uh, Rackard Hilt on the call, and he was involved. Comes out of Dr. Nikita Tucker and Nicholas and their team at the Center for Climate Health and Equity. So next slide. They got a grant from the Patient-Centered Outcomes Research Institute to develop a climate survey, and they worked with five different CBOs to develop that survey: the Coalition on Homelessness, Rafiki, Leaders for Earth, NICO, I think the Southwestern Community Coalition was there too. And they really asked people, how prepared are you for climate hazards? What do you do during heat events, wildfire smoke events, and why? What are the major barriers? Next slide. So they worked with those different CBOs to design the survey, and then and then those CBOs administered the survey, and they ended up getting 547 responses, with 96.8% filled out. And these CBOs were identified because they represent populations most vulnerable to climate hazards, including people with limited English proficiency, older adults, people with chronic mobility issues, young youth, and unhoused. Next slide. So these people lived primarily in very different settings. San Francisco has mostly multi-unit rental housing. So this is kind of the housing type distribution. Next slide. And so the biggest challenge during heat event was being a renter and being hard to modify a home, and weatherization costs. So this was the biggest challenge during heat events. Next slide. It was the same during wildfire smoke events. And all of this information can be on the website that is in the chat. Um, so this was really told us that this is something that people are feeling as a major barrier to becoming safe during heat events and wildfire smoke events. Next slide. And so these are a few of our interventions. We face similar challenges like around landlord recruitment, around we have mostly renters, we have mostly multi-unit housing. We're a cooler climate, so a lot of the incentive programs don't apply to San Francisco. So we're really looking at really what is the low-hanging fruit. And so these are two programs that we've started, and I'm excited to work with a lot of you on how we can expand or scale or innovate. So next slide. The first one is how do we layer services? So this is once again, how do we align what our asthma programs are doing with our weatherization programs? We have a climate equity hub run out of our San Francisco Department of Environment and Benny Zank. And so they do a lot of weatherization retrofits, and how can we connect them to our asthma remediation services? So next slide. Um, that would be we have made a pipeline between our pediatric asthma and allergy clinic and our adult asthma and allergy clinic and our climate equity hub, so that our case managers at the asthma clinics can refer patients to the climate equity hub. Next slide. And I'm running low on time. The project that I'm working on right now with my colleague Rachel Blythe, who I think is on this call, is a home health adaptation project, which is a research project to understand the landscape of interior home health services offered in San Francisco. We know that there's a lot of silos that, once again, Spider-Man meme, there's a lot of different people that are focused on tiny pieces of home health adaptation, that we have lead programs, we have weatherization programs, we have asthma programs, and they're all with dedicated funding streams that are uh, disease specific, and that they all don't refer patients to one another. So we're going to do a kind of a mapping exercise of where these programs live, how do they case manage patients, and we hope to expand this to a lot of people that aren't city programs on this call. And the hope would be to develop some recommendations memo about how we can align between these different programs to really drive interventions across the board. I think that's my last slide. Do I have another one? Oh, our deliverables. So we're going to have a needs document, a best practices memo, a workflow diagram, and the goal would be to develop a policy proposal and hopefully a grant application for how to better align these services, knowing that the same things that make use generally safe for wildfire smoke and extreme heat align with other programs that are already offered in the city. So I think that's it for me. Happy to answer questions and look forward to coordinating in the future.